So I started here in 1999, and I was the clinic nurse. I saw in the clinic area that there was this huge need for immunizations because people would come for care with the physicians and then they would just leave. And at the time, all the immunization charts were kept separate from the regular client chart. They were in a different file, they were in a box. So I and another staff member advocated, and we put them in the back of the chart. So we started doing that and then saw a large uptake with immunizations. So we started that, and then I started working in community health with Well Baby and Well Baby visits and everything. So people would come in and they would come from another place, or they weren't sure whether they were immunized somewhere else. And so we'd have to call, say, to Septena or Siksika or wherever for their immunization records. And sometimes it was difficult to get that information on the spot. And our clients like to have things done quickly. So if we had to say, oh, you know what, we have to call and then they have to fax us these records, that didn't work for them. So I was so thrilled when Sal and his team came to pilot a project, and the idea of it was just, I couldn't believe it. I thought, this is amazing, how can this happen? So when we got online, and even with only a few communities that we could speak to within CHIP, it was amazing because then you could see their immunizations. That's the really quick and dirty timeline that took years and years to develop to where we are now, that it's it really works for us.
So we use CHIP every single day here in practice. It's one of the first things I log into in the morning because we're checking clients' immunization records when they're here seeing doctors, and we're able to quickly access those records and then offer the immunizations while they're here.
I spend a lot of my time calling people to let them know, and going through the recall list and trying to find people who are, kids particularly, who are due for immunizations. And it has made it so much easier to find people. Because historically with paper records, it was really hard to figure out who was due and who we should call to let them know. And now it's a click of a button and we pull it up, and then we're able to call the parents of every kid that's due for immunizations, and it has improved our rates considerably.
I think just the ease of it, it's nice the way it's set up that we can use it with the internet. So, because we do provide in-home immunizations in the community, so we just have to bring a laptop and then we can access CHIP. So the way that it's set up, I think it's helpful. So it gives us the opportunity to do that, to look up client records when we do go in their homes. So I find that's a really good feature to have.
Because if we're going to provide services for clients, it has to be comprehensive, and it has to not just one thing. Like, I'm not just going to give a flu shot if they're due for something else, and I'd like to know if they're due for something else. And I'd also like to provide that if somebody wants it. If somebody doesn't want it, absolutely, but to say, okay, I'm seeing your record here and you're due for 2 or 3 other immunizations. Would you like them? Then I'd like to be able to do that, and I do.